Hello, my name is Daril Howard, and I'm a sophomore health science major on the pre-medicine track attending Spelman College. Today's presentation will focus on allogenic blood transfusions and their relationships to patient health outcomes. Allogenic blood transfusions are defined as a process in which blood is intravenously transferred from a donor to the recipient. Blood transfusion treatments have beneficial results in the way that they can reduce patient surgical complications related to hemorrhage and other risks. Although blood transfusions are generally safe, they are not without potential complications. Blood transfusions have the potential to produce long-term effects on patients with cancer, such as immunosuppression, allergic reactions, and acute immune hemolytic reactions. I will be addressing the question, what effects do blood transfusions have on renal cell carcinoma patients undergoing nephrectomy? This research is important to further analyze how beneficial blood transfusions truly are and discover alternatives to using these approaches. The kidney is the fundamental organ that creates urine, controls blood pressure, and stimulates the creation of erythrocytes. Kidney cancer is a disease in which cell growth becomes unmanageable within the kidney. In 2022 alone, more than 79,000 individuals suffer from this type of cancer, as it accounts for 90% of renal malignancies. Men are more likely to suffer from kidney cancer in comparison to women. Older adults are more likely to suffer than younger adults, and minority patients are more likely to be diagnosed than their white counterparts. Symptoms of kidney cancer include, but are not limited to, hematuria, back/thigh pain, fever, unexplained weight loss, loss of appetite, fatigue, and anemia. Kidney cancer can be diagnosed by blood tests, urinalysis, CT scans, MRI scans, ultrasounds, chest x-ray, bone scans, and kidney biopsies. The staging of kidney cancer is based on the T&M scale. The T&M scale notes T, primary tumor, N, lymph nodes, and M, distant metastasis. The different levels of these three categories account for the assigned stage of cancer overall. For example, stage 1 only includes a less than 7 centimeter tumor, while stage 4 might include a large centimeter tumor, metastasis in the regional lymph nodes, and distant metastasis. There are different ways and multiple treatment strategies to combat kidney cancer, but the most common methods include radical/partial nephrectomy, cryotherapy, radiofrequency ablation, immunotherapy, chemotherapy, and medications such as Sutent, Nexavar, Votrient, Camotex, and Lenvima. I will be exploring the effects that allogenic blood transfusions have on cancer patients by examining the effects that it has on renal cell carcinoma patients undergoing nephrectomy. Based on data from other non-kidney cancer analyses, we hypothesize that blood transfusions will have adverse effects on cancer patient outcomes such as complications, recurrence, and survival. Data from Winship Cancer Institute of Emory University, Moffitt Cancer Center, and Vanderbilt University Medical Center includes entries from 633 patients. 419 patients, 66% were men, and 212 patients, 34%, were female. The median age of all patients prospectively was 64.6 years old. These patients all experienced nephrectomy in which the tumor was recognized as greater than TB2 cancer, meaning the tumor was fairly large at 10 centimeters and metastasized to other portions of the body. Of this demographic of patients, only 20% of them underwent the blood transfusion process. Data results show that the chance of complications occurring after transfusions was very high. The data showed that 144 patients from a 633 patient population, 23%, did not survive following their transfusions, in relation to the 486 patients, 77%, that did survive. 168 patients, 27%, showed a recurrence of cancer, while 452 patients, 73%, did not follow the procedure. The data shows a significant difference between patients that underwent/who did not undergo transfusions. 20% of patients with locally advanced kidney cancer who have nephrectomy undergo a blood transfusion. Patients who had transfusion experienced higher rates of complications, increased risk of recurrence, and decreased survival. Overall, the data expresses that transfusions were not a beneficial procedure for patients undergoing nephrectomy. We show that allogenic blood transfusion is associated with a higher rate of complications, kidney cancer recurrence, and a decrease in overall survival compared to patients who did not receive an allogenic blood transfusion during surgery for locally advanced kidney cancer. Therefore, we show that allogenic blood transfusion is associated with a higher rate of complications. To combat these issues, practitioners must discover ways to find other solutions. Directions for future research could involve specific methods that do not prioritize blood transfusions, but instead include alternative techniques that assist in blood conservation during surgical operations. Effective techniques include alternative therapy, bloodless medicine, hemolytic growth factor, and autologous transfusions. These processes serve to expand and produce more blood within the bone marrow prior to the procedure or provide a safer alternative for patients. Thank you.